Hello, my name's Nick Dash. I'm an optometrist from the UK, and my practice has become dedicated around contact lenses, the corneal surface, corneal laser surgery, and in all these situations we need to deal with dry eye disease. It's not just something that happens in the general population, but it's something that I've dedicated my life to, both clinically for my patients, but also in terms of research and in terms of my work as honorary lecturer at Cardiff University in Wales. Here we have a great new device called the IDRA, which is a dry eye examination and diagnosis. So it's simple and straightforward. It sits on a normal slit lamp application. So here we have the device. We have different heads for different measures. So we have a Placido disc cone, which sits on the device, and this allows us to look at tear breakup time. And we also have another device, which is a white cone, which looks at the interferometry, the quality of the meibomian gland function and that lipid layer. So it's quite easy to put these cones on the front of the device and then just with the device look at obtaining some of the images. So here we have a laptop that just allows us to focus. And here I have the Placido disc looking at that quality of the tears, and we can see breakup time. Simply I start a video, and the video itself will record the blinks and the breakup of the tear film during the course of a normal blink routine. So no instructions to the patient, just a normal blink, and then just analyzing that tear surface. We can also then take a little measurement along the lower lid, looking at the top of the tear meniscus, and then place another cursor on the eyelid margin, and that gives us the tear meniscus height, which is a valuation of the quantity of tears. The interferometry itself will actually look at the quality of the tears. So we have a measure in terms of how much tears there are, which would be an indication, if it was subnormal, of aqueous deficient dry eye. If we have a tear breakup time and the interferometry is anomalous, abnormal, we would actually say the quality of tears is worse, and that may well drive an evaporative dry eye condition. So here we can see the interface, the computer interface with a new patient. We'll talk you through the process. So if we want to add a patient, we come down onto the plus button and fill out the details associated with that patient. So you can see it's quite intuitive, straightforward. Then when you want to take a new exam, you would click here, previous exams here. So if we go on to new exam for this patient, new examination, we then get the screen that shows all the different modalities and different measures we can actually undertake. We'll start initially with the interferometry, and as we click on this, we can see really that the head that we use is the white cone, and it's actually analyzing the lipid layer here. So if we want to start this process, we either double click on the interferometry or we come down to the start. Here we can see the next screen, and so we click on the right eye here. We've got the white cone on the eye, and the white cone allows us to do 3 different tests. The first of these is interferometry. We can see we focus initially on the iris and then come forward somewhat to focus on the cornea or the tear film. We can see that non-Newtonian, that elevation, the lipids coming up. And it's that lipid that we can then analyze. And that analyzing allows us to then go to a grading scale. But also we can now focus down on the lower lid margin here, which is the tear meniscus height. We can see that now in focus, and we can create a measure. We take an image, and then we can geometrically measure the tear meniscus. Whilst we're videoing on this video process, it allows us to analyze the blink rate and the frequency and whether it's a complete blink or partial blink. So it gives us 3 tests within one: interferometry, tear meniscus height, and blink dynamics. We've come now onto the screen that looks at the blink quality. We can see that we have some blinks here that have had a limited or an incomplete blink. If we have 100%, as we had in the subsequent blink, that's a complete closure of the eye. We're getting a complete closure. In today's world with computerized devices, we've got into the habit of only partially blinking. only partially coming down and exposing the lower cornea and the lower conjunctiva. And so in this case, we get a figure which is below 100, and it actually gives you that incomplete blink quality. We can see over here, again, we've got the grading scale, which gives us an indication that actually that's a borderline figure. If we were completely in the red, that's the eye being completely exposed, whereas a complete blink would be down in the green. Now I'd like to show you the non-invasive tear breakup time. So we go back to the new examination, double-click there, or double-click on the NIBUT, and that's non-invasive tear breakup. And we actually have the Placido disc cone on IDRA. So we undertake the test here. And what we have is we want to click on the right eye. And we focus in. We actually focus in typically onto the iris. Okay, and then come forward a little bit. Ask the patient to blink twice, complete blink, and then stare. Now keep staring, keep the eyes open, and we're looking for the breakup of the Myers here on the image. So having taken the video, we now go back into the analysis, and we click on the green cogs. That gives us the analysis, and we can see it analyzing here. Remember that the Placido discs are actually measuring that front surface of the tears, not the cornea. So we're analyzing this accurately over the course and the duration of the examination. We have over here a time stability, so we can see as we analyze this, the tears are stable up to around about 3.5 seconds, and then they start to destabilize, and it's not until about 10 seconds that we're actually getting a 10% breakup. So we could record that, but it gives us a dynamic measure. Over here we can see we actually have 3 blinks, 1, 2, 3. And we're actually looking here at this 10.56 seconds exposure. We can again see the traffic light system giving us a borderline figure, but it's giving us a concept of the dynamics of the tear film. We're actually seeing here where the breakup is at its greatest. We're getting early breakup here and slightly later breakup and partial breakup in the mid-periphery here. We come down, we've done that, and we come on to meibography. For me, meibography is the very biggest step forward because 80% of dry eye is actually evaporative dry eye. And that's because the lipid layer has broken down. The way of assessing the source of the lipid is looking at the meibomian glands. So this is vital if you have a dry eye clinic. So here we go, we click the start button on the IDRA, and we actually can look initially, I think we'll look at the lower lid. So we help to focus on that area, placing a little bit of pressure on the lower lid, and this causes the lid to invert. And we're exposing this lower area. With the infrared technology, we can image that, and this allows us to highlight the meibomian glands and give us a good, true, 3-dimensional anatomy. We click that process, and we can then see that image, and it's analyzing the meibomian glands and gives us a percentage meibomian gland. So having saved that by clicking at the top, we can come back and we've saved that for future. We end up with the image here, again saying that there's a significant level of loss. But also we have this traffic light system again, which is saying it's normal in terms of an age profile.